Pulmonary artery pulsatility index is a recently described hemodynamic index. It is used to predict right ventricular failure in those with inferior wall infarction and those who have been implanted with left ventricular assist device. It is also useful to assess the need for biventricular impeller support in those with cardiogenic shock on the mechanical circulatory support device impeller for the left ventricle. Pulmonary artery pulsatility index equal to pulmonary arterial pulse pressure, that is difference between systolic and diastolic pressures, divided by the right atrial pressure or central venous pressure. This is the pulmonary arterial pressure divided by the right atrial pressure, which is in fact the right ventricular filling pressure. PAPI can serve as a marker of right ventricular dysfunction in patients with advanced heart failure and was found to be strongly predictive of adverse clinical events in the ESCAPE trial. PAPI was significantly associated with clinical features of right ventricular failure, that is elevated jugular venous pressure, ascites and edema, echocardiographic signs, that is right atrial size, IVC size, tricuspid regurgitation velocity, and hemodynamic signs of right ventricular failure like elevated right atrial pressure. PAPI was an independent predictor of primary endpoint of death or hospitalization at 6 months. PAPI was found to be useful in primary pulmonary hypertension as well. 272 patients from the National Institutes of Health Registry for Primary Pulmonary Hypertension were evaluated by Masimba and colleagues. They found that PAPI was independently associated with survival in primary pulmonary hypertension. Here are a couple of references including the initial reference for PAPI. Here are another two references including the ESCAPE trial.